So hello everybody. Today we have a master thesis presentation by Anna, and I believe Anna, you will say the title of the thesis and will share your slides and will present your work. Thank you.
Yes. Hello, everyone. My name is Anna. I'm doing my master's in pharmaceutical sciences at KU, and I'd like to present you the results of my master thesis because you really helped me recruiting people and promoting my research. And I would like to share my screen just to show you. Is it working? I think it is, right? Just give me 1 second. Can you see my screen?
Yeah, we can see your screen. Now it's on the presentation.
Okay.
Oh, so all is fine. Yes.
Okay, great. Just then give me 1 second, please. Okay. So my name is Anna, as I said, and I'm doing my master thesis with Ramune in social pharmacy at KU. And the title of my master thesis is Exploring the Needs for Developing Educational Materials to Strengthen Inclusive Care for LGBTQIA+ individuals in Community Pharmacies in Denmark. So maybe some of you were present in the previous meeting, but I would like to give you an introduction and a background as a reminder in case you were not here, or just to remind you. So why we chose the topic of LGBTQ plus healthcare in community pharmacies. It is known from research that LGBTQ plus people face healthcare disparities, and community pharmacies are a first-line healthcare gate. However, there is limited to non-existent relevant research in the European Union about the topic of pharmacy practice, specifically for LGBTQ plus people. And since pharmacy practice should be provided the highest quality for everyone, and pharmacy encounters may shape healthcare care experiences in subtle ways, we found it rational to explore that topic. Unfortunately, there is no structured education for LGBTQ plus healthcare in pharmacy curricula for pharmacy staff. Therefore, we had the idea with my supervisors to explore that, and we shaped some research question. The main research question is how can Danish community pharmacies provide more inclusive pharmaceutical care for LGBTQ plus people? And we divided into three sub-questions. The first one was how do LGBTQ plus individuals experience interactions in Danish community pharmacies? And then it was about how community staff, how pharmacy staff perceive their role, competencies, and challenges in providing inclusive care. And then we would like to use co-creation methods about what strategies can participants from both stakeholders groups propose to improve inclusivity in Dutch community pharmacies. And this is where you contributed in the recruitment and promotion of the research for the pharmacy staff to recruit for the last two research questions. So for the methods and the results, what this thesis was about, and the study design, the thesis is based on qualitative research and innovation method, and it has 3 phases. So the first phase was the conduction of individual semi-structured interviews with LGBTQ plus people, then an online focus group interview with community pharmacy staff. And then I also did an online co-creation workshop, which was inspired by the design thinking model. To give you a bit of overview, what is a design thinking model? It's an innovation technique that would like to obtain a clear understanding of an ill-defined problem and its stakeholders, and to propose and test possible solutions. In this case, how could improve community inclusive pharmacy practice for LGBTQ plus people. It has 5 phases, the design thinking model: empathize, define, ideate, prototype, and test. In this thesis, we went up to the ideate phase. So the first phase, the empathize, which is about to understand stakeholders' needs. I conducted the interviews with LGBTQ plus people and the focus group interview with the pharmacy staff. Then to define the problems, I coded and analyzed the findings. And for the ideate phase, I use the findings to create a workshop for both stakeholder groups, as I said, to try to find possible solutions. and proposals. Just give me a second because it does not. Yes. So the first phase, it's about the individual interviews that I conducted with LGBTQIA plus people. So I conducted six interviews, as I said. I conducted them online or in person, and we explored the themes of healthcare access and pharmacy practice in Denmark. Here in the table, you can see that there is a broad spectrum of the LGBTQ plus community. I had 3 out of 6 transgender people, but they were also different one from each other in terms of the spectrum of the community. So the insights from the individual interviews overall, what did these people say? Their overall experience in Danish community pharmacies was positive to neutral, and there was no incident of disrespectful or discriminatory behavior, and the people valued small signals of inclusivity and staff awareness to the extent it exists. However, unfortunately, they felt that their interactions in the pharmacies are very transactional, and there's a high turnover of pharmacies, and they believe there was a lack of rapport and trust, and the pharmacy staff didn't have a decision-making power. They also had issues with lack of privacy and design of the pharmacy, and they also talk about language barriers, specifically for English language. However, some others of them were really satisfied with the English level of the pharmacy staff. Overall, they also feel that they're not being understood, but it was not personal for the pharmacy staff per se, but from healthcare professionals in general. They also wished for not having face assumptions and prejudices from healthcare professionals, and they would also like a personal relationship and inclusivity education for the pharmacy staff. Then we had the second phase, which was the focus group interview with the pharmacy staff. And since there was a common recruitment process for the pharmacies, for the focus group interview and the co-creation workshop, I would like to tell you a bit about the recruitment because you also really helped me on that. So how we tried to recruit, I did a post on my personal LinkedIn profile. So and you also were really kind to share the invitation among your members through emails, if I understood correctly, but also through LinkedIn and other channels. And I also hung some flyers at the University of Copenhagen in Pharma School and at the Student House, which is the coffee place at the city center for students. From the recruitment process for the focus group interview, I had 3 participants, and it was held online for convenience reasons and due to geographical restrictions. You will see that we have location of employment, different areas in Denmark, which is quite good. And we had 2 pharmacy technicians and 1 pharmacy student. And the pharmacy technician was also part of the LGBTQ plus community. And when it comes to years of experience, there is also a quite broad spectrum from a couple of years, 1 pharmacy technician, to 32 years, another one. And what is important to mention is that 2 out of 3 participants were recruited through NUAP channels. So thank you very much for that. And what the focus group interview actually revealed, and I'm going to present you the key themes. First of all, about the interactions, the pharmacy staff expressed that they do their best to their abilities to provide equal treatment for all patients. However, they feel uncertainty about the use of pronouns, but they also said that there is a low customers engagement that hinders pharmacy practice. And then about the barriers, they also said that they face some barriers that are not in their control and they really affect their provision of services. For example, when the CPR number of a patient or customer mismatch their gender and their physical appearance, it can create friction and it can create uncertainty. And the IT systems, for example, the PharmaNet, that's what was mentioned, does not really help with that because there is a 6 months time frame where the name doesn't change, so it can also create uncertainty for the pharmacy staff. And they also talked about the time and privacy issues because of the high workload and workflow and the limited privacy between the counters that does not allow for sensitive conversation, especially for a population like the LGBTQIA+, which is quite sensitive when it comes to counseling. Then we talked about the education. They all agreed that they miss formal training, and most of the times they learn on the job, meaning through experience, and they wish for guidance on hormones and communication. When we're talking about hormones, we're talking about gender hormonal replacement therapy for transgender people mostly. And then they talked about professional role and the emotional challenges. We have also touched it a bit in the previous themes. Due to the barriers that I mentioned before, they feel many times limited on how much they can help because of system rigidities. They also talk about management of their boundaries, about the professional and personal boundaries, especially, for example, for the pharmacy technician who belongs also to the community. It's sometimes a bit tricky to navigate around those boundaries. And they also talk about small strategies on how to navigate through system limitations. For example, the shortages that we unfortunately all know, for example, about medication on hormonal replacement therapy, especially estrogens these days. And then we had the third phase, which was the co-creation workshop. After talking with the pharmacy staff, we brought the two stakeholders group together. So overall, four people participated in the workshop, two of its group. It was also online for convenient reasons. And what is important here is that 3 out of 4 participants participated in previous phases. So the two LGBTQIA plus people participated in the individual interviews, and the pharmacy technician, who is also the one who is part of the LGBTQIA plus community, participated again in the workshop, allowing for continuity in the results and depth as well. So how the workshop was actually made. After the introduction and the context setting, there were 3 phases. So I asked for the participant to do a brainwriting, because they were writing, but it was basically a brainstorming of the ideas that I will explain to you shortly. Then from these ideas, they prioritize them. And then from the prioritization of ideas, I asked them to propose practical solutions on how we could actually make them happen. So about the brainstorming, what I asked them to do, I used the method from the innovation side, which is called How Might We? So I gave them 2 questions. The first one was, how might we make pharmacy interactions feel safer, more respectful, and more comfortable for LGBTQ plus people? And the second one was about education and knowledge. So how might we strengthen pharmacy staff's knowledge and confidence in LGBTQ plus health topics. So the first one was about interactions, and then about knowledge. So they did the brainstorming, and I tried to group the answers for the 2 different questions. And what they said about the interactions, how to improve interactions, they talked about privacy between counters, continuity, familiarity with staff, and visible great signals. And what we mean with familiarity with staff is mostly about building trust in the pharmacy team or system through communication and transparency for pharmacy's operational processes, because mostly they had issues, as it was expressed, for the turnover, that people do not see the same stuff every day, every time they go to a pharmacy store. And then about the knowledge and confidence, they thought about having training on hormone treatments, training on how to execute non-Danish prescriptions, because it can be a bit tricky, especially for hormonal replacement therapy. Then how to ask, pronounce respectfully, and have inclusive, non-judgmental communication. And they believe that this could happen in collaboration with LGBTQ plus organizations or the campaigns that run in the pharmacies throughout the year. So when I asked them to prioritize, feasibility, as I write here, shaped prioritization in terms of what would we actually propose. So they choose what I called here familiarity with staff, training on hormone treatments, and inclusive, not judgmental communication. However, there's some overlapping, because, for example, inclusive communication can be also asking about pronouns. And they also said, I'll tell you in a bit on how we could do that. So collaboration with the organizations or the campaigns in the pharmacies. So when I asked them to propose practical implementations about the building trust in the pharmacy system, as I mentioned before, that we have an issue with the high turnover of the pharmacy staff, and what they thought would be useful is to increase familiarity for international about the pharmacy system, and in general improve transparency and communication about how the pharmacy system works. So despite the high turnover, if people know that this is how the system operates, they can have trust in the system, even if they do not see the same pharmacy staff when they revisit the store, if it makes sense. And some other solutions that were not prioritized, but they were heavily discussed in the workshop, was about the signaling of LGBTQIA plus alliance, either on individual or collective or national level in pharmacies as guidelines. They thought there is a risk of politicization of the topic, of being interpreted the pharmacy as a political space, and they would like to avoid that because it can create friction. And they also talk about the privacy between the counters, as I mentioned before, from the interviews, but also from the focus group interview. And they believe that it's something that in order to change, it would be quite expensive. And there are also spatial restrictions because some pharmacies might be smaller. So they didn't prioritize those solutions. Then about the knowledge, the education and confidence, I asked them, okay, what would you like exactly on knowledge? And they said it could be good to have better knowledge on the dosages, on gender affirming hormonal replacement therapy and the guidelines, because especially the pharmacy staff expressed that they feel very uncertain about that, and they have only guidelines for menopausal and perimenopausal women and not for transgender women. They also would like to have more education on the use of pronouns and inclusive language, and also about empathy training. And since it was a co-creation workshop, everybody agreed on that. Also the LGBTQ plus individuals. So how we could do that education? So they thought about formal education in the form of lectures, webinars, or facilitated in-person sessions. And they also thought it would be good to implement in the pharmacy campaigns, as I said. They also had a discussion about open access videos, whether they could have, there could be education through open access videos. But one person said that she had done that in the past, and there was a risk of misuse and interpretation again for politics, and this can also create friction as well. So they believe that in person or webinars like this meeting that we have now would be beneficial and less risky. So overall, to wrap up all the findings, we had 3 cores of findings. First of all was the pharmacological/clinical educational needs, where they prioritized from the workshop the training on the hormones. Then about the communication, because both group stakeholders feel that there is room for improvement on the communication, both for how to feel safe from the LGBTQ plus individual side, but also for the pharmacy staff to feel confidence. And then the other finding was about the system and organizational barriers, which is something that pharmacy staff and LGBTQ plus people cannot do anything. It's not in their control, but it would be good to suggest structural solutions to the relevant stakeholders. So overall, as I have said, inclusivity is multi-level shaped, and it has to do with educational, organizational, and structural factors, and requires both of those changes and improvements. And all these findings, I have also presented them in a conference, in a European Association of Faculties of Pharmacies conference with my supervisors. We created with a poster. The theme of the conference was Agile Pharmacy Curricula, and they found in the conference that the topic was quite innovative and interesting, and they awarded the poster. They gave the prize for the best poster, and you have also contributed to that. So I'm really, really grateful for that. And taking this for the future perspective as well, I believe this research would be quite a good step for a future research in the topic on how to improve the pharmacy practice. Also, maybe take the findings and do educational proposals to relevant stakeholders, also for NUA, because I know that you're really active and you're really interested in providing the best care possible. And it can also, this thesis can also be a baseline for long-term visions for pharmacy practice of how to improve, and also for proposal for system improvements, as I said, about the privacy, about the high workflow. But this is not something that we can actually we can propose, but we cannot say that there's one solution or ABC solutions. So to wrap up, I would like to thank you for your contribution to this thesis and project. Your contribution has been of an extreme value, because otherwise I wouldn't have any participants, and I wouldn't be able to have all these findings. So thank you so much for that. And I would like to ask you if you have any questions and comments. I would be more than glad to answer them. Thank you.
Thank you very much, Anna. It was really good. Now I will stop recording, so questions can be asked and answered without recording. So I'm stopping recording.